For 30 years, I've treated over 50,000 patients, and here's what haunts me. The ones who came in a crisis, heart attack, stroke, kidney failure, almost never arrived without warning. The warning was there. It was just ignored, never measured, or never even known to exist. Your body has been sending signals for years, maybe a decade. Quiet, invisible, no chest pain, no dizziness, no drama, just numbers, slowly drifting in the wrong direction. And here's the truth that changed my entire career. Those numbers are available to you right now, with a basic blood draw and a $30 device from any pharmacy. Today I'm going to show you the 6 numbers that tell the real story of what's happening inside you. I call it your body's dashboard. Every pilot checks the dashboard before takeoff. Every engineer monitors the gauges before running the engine. But most men over 45 go years, sometimes decades, without ever glancing at theirs. That stops today. But I need to warn you about something. There's one specific mistake that makes all 6 of these numbers meaningless, even if you check them. Most people hear information like this. They feel motivated, maybe even a little scared, and then they do nothing. Or they check one number, see it's in range, and assume everything is fine. Or they intend to schedule the blood work, and it drifts to next month, then next year, then never. Knowing does not protect you. Intending does not protect you. Only the test itself, the actual number, the actual conversation with your doctor, changes outcomes. Stay with me until the end, because in the second half of this video, I'll show you exactly how to turn these numbers into years of extra life. Blood pressure is called the silent killer for a reason. Not a dramatic reason, a quiet, devastating one. There are no nerves in your artery walls that sense pressure. That's not a flaw, it's just biology. So when your blood pressure reads 150/90, you feel nothing. You have your coffee, you drive to work, you feel fine. And meanwhile, every single heartbeat is hammering your artery walls, your kidneys, your brain, with force they were never designed to sustain. Think of a garden hose. Run full pressure through it every day for 10 years. The rubber degrades, it stiffens, it cracks. Your arteries work the exact same way. I had a patient named Marcus, 58 years old, construction manager, never missed a day of work. He came in for a routine physical. Blood pressure 162/98. He laughed when I showed him, said he felt fantastic. We ran more tests. We found early thickening of his left ventricle wall from years of pumping against that pressure. Not damage from last month, years of accumulated destruction, and it had never announced itself once. Here's what you do. Buy a home monitor, $20 to $40. Check it every morning, before coffee, after sitting quietly for 5 minutes. Take 2 readings, average them. Target 120/80. Above 135/85, that's your signal to call your doctor. Not next year, soon. Blood pressure is the single most controllable risk factor for stroke and heart attack, and the most ignored, because you can't feel it going wrong. That changes today. This one surprises everyone. Your resting heart rate, how many times your heart beats per minute when you're doing nothing, is one of the most powerful predictors of how long you will live. Lower resting heart rate equals longer life. Healthy range, 50 to 70 beats per minute. But if yours is consistently above 80 or 90, your heart is working overtime every single hour of every single day. Do the math with me. At 90 beats per minute instead of 60, your heart performs 43,000 extra beats every day. That's 15 million extra beats per year. The muscle works harder. The electrical system strains. Inflammation rises. And what do you feel? Nothing you'd call a warning. Maybe a little tired, poor sleep, but you blame that on age. Check yours. First thing in the morning, before you get out of bed. Smartwatch or 2 fingers on your wrist. Count for 30 seconds. Double it. Above 80 consistently? Write it down. Above 90? Don't wait. The good news: resting heart rate responds fast. Brisk walking 30 minutes a day. Better sleep. Less caffeine. Most of my patients drop 10 to 15 beats in 6 weeks. Not months. Weeks. Your choices show up directly in your data. That feedback loop is powerful. Quick question. Do you know your resting heart rate right now? Not a guess. The actual number from this morning. Comment below. I read them. eGFR, estimated glomerular filtration rate. This tells you how well your kidneys are filtering your blood, and it may be the most critically underappreciated metric on this list. Here's why. Your kidneys can lose 40%, 50%, even 60% of their function before you feel anything. By the time you notice swollen ankles, fatigue that won't go away, or changes in your urine, significant and often irreversible damage has already happened. I've had patients with an eGFR of 30, meaning they'd lost 2/3 of their kidney function, who came in for something unrelated and had no symptoms at all. They felt fine. Their kidneys had been quietly compensating for years. Your kidneys have 1 million tiny filters called nephrons. When some are damaged by high blood pressure, high blood sugar, or years of ibuprofen, the rest just work harder. Brilliant survival adaptation. But it means you lose enormous capacity before the system ever cries for help. Ask for a basic metabolic panel at your next blood draw. Target eGFR above 60. Above 90 is optimal. Between 45 and 60, yellow flag. Below 45, see a kidney specialist. Kidney damage caught early is often reversible. Caught late, you're managing a progressive condition for life. One blood test, one number. It could be the most important number you've never been told to check. Most people have heard of cholesterol, but here's what they don't understand. Total cholesterol is not the number that matters most. What matters is the combination of LDL, bad cholesterol, and triglycerides, and how they interact. LDL particles embed themselves in artery walls. Your immune system attacks them. Cells get trapped. Plaque builds up. Over years, decades, in complete silence. That plaque becomes unstable. Then it ruptures. That rupture is what causes most heart attacks, not a slow narrowing. A sudden crack, a clot, and you're on the floor. High LDL plus high triglycerides equals unstable, dangerous plaque. Triglycerides above 150? Address it. LDL above 100? Have the conversation with your doctor. Here's what surprises everyone. If your triglycerides are high, the first intervention isn't a statin. It's sugar. Refined carbs, sweetened drinks, alcohol. The liver turns excess sugar into fat. That fat circulates as triglycerides. I've seen triglycerides drop from 280 to 110 in 3 months. No medication. Just cutting sweet drinks, white bread, and late-night snacking. That's not luck. That's biology. LDL is more stubborn. You may need medication. But don't postpone because you feel fine. Elevated cholesterol feels identical to normal cholesterol. No symptoms. Ask for the test. A single fasting glucose test tells you what your blood sugar is doing on one specific morning. Eat well the night before. Sleep 8 hours. That number looks fine. HbA1c tells you the story of your blood sugar across the past 2 to 3 months. It measures hemoglobin that gets permanently modified when glucose is chronically elevated. You cannot cheat this test. Chronically elevated blood sugar, even moderately elevated, not yet diabetic, damages every system in your body at the same time. Blood vessels, nerves, kidneys, retinas, heart. Pre-diabetes, HbA1c 5.7 to 6.4%, affects 1 in 3 adults over 45 in the U.S. Most have never been told. Many have never had the test. I've seen reasonably fit men, active jobs, not overweight, with an HbA1c of 6.1, no symptoms, and potentially 10 years of cumulative vascular and nerve damage already underway. The nerve damage that causes numbness in your feet, balance problems, reduced sensation, that process begins at blood sugar levels well below the diabetic threshold. You can be not diabetic by standard definitions and still be falling apart inside. Your target? Below 5.7%. 5.7 to 6.4%? Pre-diabetes. You can reverse it. Above 6.5%? Type 2 diabetes. You need a treatment plan immediately. Request HbA1c at your next physical. One blood draw, one of the most informative tests in medicine. ALT and AST, your liver enzymes. They live inside liver cells. When those cells are damaged or inflamed, the enzymes leak into your bloodstream. What we're catching in middle-aged men, non-alcoholic fatty liver disease, affects 1 in 4 adults globally, strongly linked to high triglycerides, high blood sugar, high blood pressure. And in early stages, when it's fully reversible, no symptoms whatsoever. Your liver is the metabolic headquarters of your entire body. It regulates blood sugar, processes hormones, including testosterone, filters everything you eat, drink, and breathe. When your liver is inflamed or clogged with fat, your hormonal balance breaks. Your metabolic rate drops. Inflammation spreads. Many men with persistent fatigue, brain fog, unexplained weight gain. They have elevated liver enzymes and never knew it. The liver was struggling. Everything downstream was affected. Normal ALT/AST below 40. If elevated, the most powerful fix? Reducing added sugar. Same root problem as high triglycerides. Fix the root, and multiple numbers improve together. Fatty liver caught early is one of the most reversible conditions in all of medicine. That's genuinely good news. Now I need to be direct with you. Everything I just described, all 6 metrics, all the targets, all the steps, will not help a large portion of the people watching this. Here's why. You feel motivated, maybe even a little alarmed, and then you do nothing. Or you check one number, see it's normal, and assume you're safe. Or you intend to schedule the blood work, and it drifts to next month, then next year, then never. The 6-number dashboard only works if you actually look at it. In 30 years, I've seen patients who could recite biomarkers from memory, who still died from a preventable condition, because they never turned knowledge into action. Feeling healthy is not a measurement. Feeling healthy is a story you're telling yourself based on the absence of obvious symptoms. The only way to actually know what's happening inside you is to check the numbers. Here is exactly what I want you to do before this week is over. Not next month, this week. 1. Schedule a blood draw. Comprehensive metabolic panel, plus lipid panel, plus HbA1c. 1 appointment, 5 of your 6 numbers. 2. Buy a home blood pressure monitor. Use it for 7 consecutive mornings. Same conditions. Average the readings. Write it down. 3. Check your average resting heart rate from the last 7 days. It's on your smartwatch or fitness tracker. You just haven't looked. 4. The secret weapon. Tell someone. Your wife, your brother, your friend at work, your doctor. Say out loud, I'm doing this. Social commitment changes everything. It makes a private intention real. When your car's check engine light comes on, do you wait until the engine seizes? Of course not. That would be irrational. But your body doesn't even have a check engine light for most of these conditions. The damage accumulates in complete silence, for years, sometimes decades. The dashboard I've given you today is that light. The gap between where you are right now and a serious health crisis, that gap is your window of opportunity. And inside that window, the interventions are simple. Walking 30 minutes a day, reducing added sugar, consistent sleep, small changes that compound into dramatically different health trajectories. Don't wait for the crisis. The crisis is where modern medicine saves lives with tremendous skill. But the gap before the crisis, that's where you get to save your own. Know your numbers. Check them every year. Track the direction they're moving. And if they drift the wrong way, act. While acting is still simple. I've worked with over 50,000 patients across 3 decades. The ones who do well long-term, not the ones with the best genetics, the ones who paid attention early, who came in with their numbers written on paper, who made small adjustments when adjustments were still easy. That's not luck. That's a decision made before it became urgent. You now have the 6 numbers. Use them. Share this with someone you care about, a brother, a father, a colleague. That share might matter more than you realize. Take care of yourself. I'll see you in the next one.